I again have a problem to change the slides. Okay. As I already mentioned to you yesterday, my scientific heart belongs to a number of organizations. Among them is, of course, ESPGHAN, European Society for Pediatric Gastroenterology, Hepatology and Nutrition, but also IACI, European Academy for Allergy and Clinical Immunology. I'm mentioning it because I will be speaking about the guidelines of this organization. Everyone in this room knows that prevention is better than cure, and this also applies to food allergy. As a matter of fact, there is a number of documents relating to food allergy prevention. They were summarized in this review paper. I will not go through all of those papers, but I will tell you what are the major changes in the guidelines in the last few years. First, population of interest. Previously, interest was mainly in high-risk population. Now, the interest is in high-risk population, but also in normal, general population. Risk definition changed. Previously, it was based on family history. Nowadays, there is also interest in infants' own risk. We all know that infants with eczema early in life have a higher risk of peanut allergy and eggs allergy later on. And last but not least, the approach to potentially allergenic foods changed from avoidance to no need of avoidance and active introduction. So these are the major changes in the guidelines in the last few years. What is new? I would like to tell you about the updated guidelines from IACI, European Academy of Allergy and Clinical Immunology, on the prevention of IgE-mediated food allergy. Those guidelines were developed by a group of representatives from various countries. They were led by Susan Halken and Antonella Muraro from Denmark and from Italy, and I had the privilege to contribute to those guidelines as well. The guidelines were based on a systematic review, which was published a little bit earlier. A number of nutritional interventions were covered in these guidelines, and I will try to summarize them in my presentation. On this slide, I showed you, this comes from the document, the overall summary, and I'm not going to, and I don't want you to read what is on this slide. I just want to call your attention that for many interventions, there is very limited evidence, and every now and then, the evidence is limited to one randomized controlled trials. There are three sets of recommendations. Recommendations supporting interventions, recommendations against interventions, and interventions when there was not possible to formulate recommendation for or against. And let me start with recommendations supporting interventions. There were three of them, related to egg, to peanuts, and avoidance of cow's milk formulas in the first week of life. All of those are conditional recommendations, and let me briefly summarize each one of those, starting with eggs. When you look at egg, early introduction versus later introduction, you will see that the form in which eggs are provided makes a difference. For cooked hen's egg, there was 29% decrease with early versus later introduction, an absolute effect. For raw egg or uncooked pasteurized egg, the effect was from 18% decrease to 2% increase. How does it translate into the recommendation? The IACI task force suggests introducing well-cooked hen's egg, but not pasteurized or raw egg, into the infant diet as part of complementary feeding to prevent egg allergy in infants. What does it mean, well-cooked? It's well formulated in the guidelines. It's a hard-boiled egg, 10 to 15 minutes, and one should start by introducing about half of a well-cooked small egg twice a week. The next positive recommendation is for peanuts. For peanut, there are two studies, and they show 12 to 23% decrease with the early versus later introduction. The study which contributed very much to those guidelines is a LEAP study This is a landmark study which resulted in definitive changes in infant nutrition. There was a randomized controlled trial with the early introduction 4 to 11 months versus later after 5 years. And as you can see on this slide, absolute risk reduction was 12%, relative risk reduction 87%. The landmark study really showed us this early introduction truly prevents the risk, in this case, of peanut allergy. But there is an important question. How relevant is early peanut introduction in countries with low peanut allergy prevalence? The study which I showed you, the LIP study, was carried out in the United Kingdom, the country with a high prevalence of peanut allergy. I am living in a country with a very low prevalence. So this is an important question to ask. What is the recommendation from IACI? In populations with a high prevalence of peanut allergy, the IACI task force suggests introducing peanuts in an age-appropriate form as part of complementary feeding in order to prevent peanut allergy in infants and young children. So the population matters, which country, which setting you are coming from, and also the form, age-appropriate form. What is the approach of ESPEGAN earlier? The ESPEGAN states infants at high risk of peanut allergy, so those with severe eczema, egg allergy, or both, so exactly the population as in the LEAP study, should have peanut introduced between 4 and 11 months following evaluation by an appropriately trained specialist. And this is a kind of recommendation we adopted in my country when we have a low prevalence of peanut allergy. So not for every child, but for those with a high risk. If you decide to give it, what is the recommendation? This comes from IACI guidelines, 1 heaped teaspoons of diluted peanut butter, which is approximately 2 grams of peanut protein each week. Age-appropriate form, of course. The third recommendation, positive, will be which relates to cow's milk formula, and I will be speaking here the first week of life. Later on, I will be speaking about after the first week of life. So let's start with the first week of life. And here, as you can see, the evidence, limited evidence, because almost for everything we have a limited evidence. Avoiding supplement of cow's milk in first week of life, it was cow's milk infant formula based on cow's milk, resulted in a 6% decrease in the cow's milk allergy. How does it translate into the recommendation? In the first week of life, the IACI task force suggests avoiding supplementing with cow's milk formula in breastfed infants in the first weeks of life to prevent cow's milk allergy in infants and young children. So in summary, 3 recommendations supporting intervention for egg, introducing well-cooked hen's egg, but not raw egg or uncooked egg, pasteurized eggs, as part of complementary feeding. Peanuts in population where there is a high prevalence of peanut allergy, introducing peanut into the infant's diet in an age-appropriate form as part of complementary feeding in order to prevent peanut allergy. And last but not least, avoiding supplementing with cow's milk formula in breastfed infants in the first week of life to prevent cow's milk allergy. As you can see, these were conditional recommendations. What does it mean, conditional recommendation? Conditional recommendation for intervention means that many people in this situation should be offered the intervention. However, for others, different choices will be appropriate, and clinicians could help each patient make decisions consistent with the patient's preferences. Okay, so I discussed recommendations supporting interventions, and I'll explain to you what does it mean, conditional recommendation. Now, recommendations against interventions. I will not go into too many details, I will just summarize them. Against diet during pregnancy and lactation, against restricting consumption of potential food allergens during pregnancy or breastfeeding in order to to prevent food allergy in infants and young children. And the same applies to soy formula. So there is recommendations against introducing soy protein-based formula in the first 6 months of life to prevent cow's milk allergy in infants and young children. This I'm done with recommendations against interventions. And now let me briefly summarize a number of interventions where there is no recommendation for or against. Let me start. What does it mean, no recommendation for or against? What would be the implication for practice? It means that different choices will be appropriate for different people, and again, clinicians could help each patient make decisions consistent with the patient's preferences. Let me start with the first one, which is breastfeeding. When it comes to breastfeeding and allergy, when you can find whatever you want in the evidence, no association, a reduced risk of allergy, an increase of allergy. So the issue remains controversial. And of course, it was evaluated in the systematic review. This is the only intervention that non-randomized trials were included because we simply don't have randomized control trials when it comes to breastfeeding. Based on observational studies, 7 studies, more than 1,500 participants, the range was from reduction in the risk of cow's milk allergy to about 3% to increase 2%. What is the recommendation from IACI? There is no recommendation for or against using breastfeeding to prevent food allergy in infants and young children. But breastfeeding has many benefits for infants and mothers and should be encouraged whenever possible. We all know breast is best. However, there was and will always be a need for human milk substitutes, no matter how successful the promotion of breastfeeding. And then the question is, what can be used? Now let me discuss cow's milk-based formula, but after the first week of life, not during the first, as I discussed previously. And as you can see, if you look at the data, avoiding standard cow's milk formula after the first week of life, the effect ranged from 22% decrease to 2% increase. So now you understand why it translates into the recommendation. For infants who need a breast milk substitute, there is no recommendation for or against the use of regular cow's milk-based infant formula after the first week of life to prevent food allergy. Different recommendation in the first week and after the first week of life. Hydrolyzed formula, another intervention when the infant cannot be breastfed. Until 2016, all societies recommended formulas with documented reduced allergenicity in high-risk population. So it referred to partially or extensively hydrolyzed formulas. What is now? Well, if you look at the evidence, and we are only looking, once again, I would like to underline, IgE-mediated food allergy as the outcome. Reduction for partially hydrolyzed formula, reduction in the risk of cow's milk allergy, 34% to increase 11%. For extensively hydrolyzed formula, 4% reduction to 2% increase. So the recommendation is, there is no recommendation for or against using partially or extensively hydrolyzed formula to prevent food allergy in infants and young children. What are practical implications? That breastfeeding for all infants is of course preferable, but when a breast milk substitute is needed, professionals could help families consider the best possible alternative for a family's individual circumstances. And the options discussed could include a hydrolyzed infant formula when we are speaking about IgE-mediated food allergy, because this is what all the guidelines refer to. Okay, so I discussed a number of nutritional interventions which are covered in the guidelines. There are 3 more: vitamins, fish oil, probiotics, prebiotics, and symbiotics. For each one of them, very limited evidence when you look at the outcomes such as IgE-mediated food allergy. And as a result, there is no recommendation for or against probiotics, prebiotics, or synbiotics for vitamins and fish supplementation, and this applies to pregnant and or breastfeeding women and or infants. So in summary, for these IACI guidelines for the prevention of IgE-mediated food allergy, because this was the scope of this guideline, the summary is recommendations supporting intervention. It's egg as a well-cooked egg as a part of complementary feedings, peanuts as part of complementary feeding in high-risk populations. So recommendations may differ from country to country depending on the baseline risk of peanut allergy, and avoiding cow's milk-based formula in the first week of life. All of these are conditional recommendations. Recommendations against interventions that included the diet during pregnancy and lactation and soy formula. There is recommendation against those interventions. And finally, a number of interventions when there was no recommendation for or against. Breastfeeding, but of course we have to promote breastfeeding as much as possible because of other benefits. There is no recommendation for or against regular cow's milk-based formula after the first week of life. No recommendation for or against for hydrolyzed formula and for vitamins, fish oil, probiotics, prebiotics, and synbiotics. And let me finish my presentation with a very final slide. What we know is a drop. What we don't know is an ocean. And it very much applies to allergy prevention as well. Thank you very much for your attention.